Welcome back. In video 2, we are going to look at the research study that you've been asked to review, the UPTURN feasibility study. But first, what is the study really about? Well, the health condition that we are looking at is chronic obstructive pulmonary disease, or COPD. Some people call this emphysema or breathlessness. COPD is a long-term lung condition with no current cure. It can develop because of long-term damage to your lungs from breathing in a harmful substance, such as air pollution in jobs that expose people to dust, fumes and chemicals, or cigarette smoke. There is an effective treatment for COPD called pulmonary rehabilitation, or PR. PR consists of a program of exercise plus education. It's one of the best treatments available for COPD. People with COPD can be referred to PR by their doctor or a nurse, and it's free and available on the NHS. A course of PR lasts about 6 to 8 weeks and is usually run in groups. Unfortunately, 1 in 3 people who are referred to PR by their GP or hospital don't attend their assessment appointment to start the treatment. And this is the issue that the UPTURN programme would like to address. So who are we and what is UPTURN? Well, our research team is huge. We have many different organisations involved, so I'm just going to give you a brief overview of some of the people involved in this part of the programme. The lead organisation is Cambridge University Hospital's NHS Foundation Trust, and the lead investigators are Dr. Jonathan Fuld, respiratory consultant, and Professor Steve Morris at the University of Cambridge. We have 3 members of the team who lead patient and public involvement activity and make sure a diverse range of views is represented in the research. Up in York, our EDI team ensure that we are being inclusive in everything we do, from the way we recruit research staff to how we approach patients and how we design our research. Our community researchers in York will also take a lead role in talking to patients about the study and interviewing them about their experiences. Down in London, we have our charity collaborator, Asthma and Lung UK. They are the largest lung health charity in the UK and will deliver our support package to patients. Researchers at UCL and King's College London will lead the work on how patients experienced the UPTURN support and what could be improved. And here in Norwich, at the University of East Anglia, my team will be building the study database, finding NHS sites, and putting all the other pieces in place to make sure that the research is done according to regulations. The first part of our programme was to find out what reasons people have for not attending their PR assessment appointment and what we might be able to do to help. We spoke with COPD patients, their carers and family members, and healthcare professionals to find out more. We then co-designed a support package called Prepare for PR. The next step is to do a small study to see if this package is feasible and can be tested and delivered on a bigger scale to see if it actually works for patients. So what is Prepare for PR? Well, it consists of a core element, a printed and emailed welcome pack that will be sent to everyone. And then on our website hub, people can find videos about COPD and PR and watch real people talk about their experiences of the condition and of going to PR. Asthma and Lung UK will make a telephone call to people we think need the most support. In this phone call, trained staff will be able to talk about PR with the patient or a family member, talk through any concerns they might have and any additional information they might need. All patients will be able to call the helpline if they wish to. We think that the phone calls will help patients navigate what they personally need. Now that we've designed Prepare for PR, we need to see if it works. Randomized studies, where patients are randomly allocated to receive the new intervention or not, are considered the best way to test whether a health intervention works. However, they can require hundreds or even thousands of patients and can be very expensive to run. Before we start a big study like that, we need to feel confident that our intervention is as good as it can be and that our research design is likely to work. The purpose of a feasibility study is to answer questions like, does our intervention need improving? Was it acceptable to patients and healthcare professionals? Can the intervention be realistically implemented? Will the trial design work on a bigger scale? And can the data needed for the bigger trial be accessed and collected? How will patients take part in our study? Well, a patient with COPD will be referred to an NHS pulmonary rehabilitation or PR service by their GP or hospital. And that PR service will send the patient a letter about the study and give them the opportunity to opt out of taking part. And they'll have about a week to think about that. If the patient doesn't opt out, the PR service will then send their contact details to Asthma and Lung UK. And the charity's advice and service team will contact them to prepare for PR, such as the welcome pack and telephone calls. And when it's time for their PR assessment appointment, the patient will choose to either attend or not attend. And this is the key decision that we're trying to address. We would also like to ask patients about their experience of Prepare for PR and the research study. So after the PR appointment, NHS staff at the service will ask patients for permission to share their contact details with the university-based researchers. If they say yes, the researchers will get in touch with them and talk more about what this part of the study involves. They will ask if the patients are happy to sign a consent form and take part in an interview. So in this design, there is one part of the study where we will not have informed consent, that is, explicit permission, from each patient to process and share their personal data. Instead, we will give people the opportunity to opt out. And this part is where PR services share patients' contact details with Asthma and Lung UK so that they can deliver the Prepare for PR support package. That information will include their name, contact details, and if known, their ethnicity, language, and any accessibility needs. All telephone calls with Asthma and Lung UK are automatically recorded for safeguarding purposes. We will ask permission from an ethics committee to allow us to access the call recordings and the written transcriptions to learn more about how Prepare for PR was delivered and received. The recordings may naturally contain some pieces of personal data, such as patients' names, although that itself won't be used in the research. All other data we collect for research purposes in this study will be non-identifiable and not linked to a patient's name or contact details. Here's an overview of the sort of data that we're going to collect. From Asthma and Lung UK, we will collect information about Prepare for PR and how it was given to patients. Were there any difficulties in delivering it and what could be improved? From NHS services, we will ask about the referral and background information of patients, such as about their diagnosis, age, and ethnicity, and whether or not they attended their PR assessment. And then in the optional interviews with patients and families, we will ask how patients felt about Prepare for PR, which resources were the most helpful, and what could have been better. So what are patients for explicit consent? Well, this is about opt-in versus opt-out participation. Recruitment to research studies is very difficult, and it's especially difficult when patients have a disease that seriously impacts on their daily life. We know that other trials in PR services have failed to recruit participants or found it very difficult. And they may have recruited a group of patients who don't fairly represent the people who access PR services. The people with poorer outcomes, more difficult life circumstances, and from more deprived areas are the least likely to join a research study. Our Prepare for PR support package is about helping people to attend PR. If we offer people similar support in order to help and encourage them to join a research study, we wouldn't be giving Prepare for PR a fair test, and we wouldn't know if it worked in the real world. If only the people who have easy access to healthcare and research take part in our study, we won't know if Prepare for PR helps those who don't. Of course, we have to consider the risks and possible benefits of the study for patients. In this study, we're providing a low-risk intervention that is not clinical. It is a support package to increase attendance to an evidence-based NHS service. Therefore, we feel there is no risk to patients' health from taking part in the study. Sharing of personal data, such as name and contact details, between organisations always carries a potential risk of data breach, and we do have to consider how a data breach might affect patients. But the potential benefit of our research design is in reducing the burden of research processes, giving greater access to participation in research, and therefore fair access to our Prepare for PR support, which we hope will help people access pulmonary rehabilitation and therefore improve their COPD symptoms. Because we plan to use an opt-out approach to taking part in the study, we need to be absolutely sure that we give patients an appropriate opportunity to say no in different ways and at different stages. PR services will first check for patients who have registered an opt-out using the National Data Opt-out Programme before including them in the study. Then, patients will be sent a letter by their PR provider to tell them about the study and how their data will be used and how to opt out of participation if they want to. And finally, patients can inform Asthma and Lung UK or the research team directly prior to their PR assessment if they no longer want to be involved. In video 3, we will ask key questions for you to consider about the study and ask for your feedback on whether you feel this research is in the public interest. Thank you.